no, thanks to Dr. Ansel and thanks to Surmatics for the opportunity to present, and thanks to everybody for attending. Next slide. So I just have a couple of cases that I'd like to present. I found that the Pounce Venous device has kind of become my go-to because it does well in taking care of a lot of the acute thrombus and as well as chronic thrombus, which is not always apparent until you get in there and you see what you have. And so the first case is a 32-year-old male who presented with symptomatic left lower extremity venous clot. Next slide. So both the ultrasound and the venogram here showed severe thrombus affecting the superficial and popliteal veins on the left side. Next slide. Proximal to the common femoral vein, there was no thrombus. Next slide. So kind of what Dr. Ansel talked about, I kind of wanted to go through it, save some fluoroscopy images of doing that. So kind of, the patient was placed prone, got ultrasound guided access into the popliteal vein, put an 018 wire up over a catheter, and then the first step is to advance that Pounce Venous Thrombectomy catheter past the treatment location. So we advanced it past into the common femoral vein. Next slide. The basket is then unsheathed and deployed. Next slide. And then here, I'm doing a pass here with the basket deployed, kind of pulling back on the wire until the basket is out of the body. The extraction screws turn down too, and which does a good job of taking some of the acute thrombus out. Next slide. So the thrombectomy catheter also has 4 side holes, which allows for kind of spot imaging to see, how much thrombus you have left, or if there's an area that needs a little more work. Some interventional radiology guys like to put some lytic medications, which can also be placed through the catheter. But here, so after the first pass, I took a contrast injection, and you can see because there was still a lot of thrombus left, it made for a lot of thrombus hangup. But as a result, it made for a nice image showing how the expanded baskets both engage and help remove the thrombus. So I'll let that play. You can kind of see the thrombus being extracted real time. Let's go next slide. So after 3 passes, the majority of the thrombus was removed. There's good blood flow. The image on the far right there shows, as you can tell, both acute and significant chronic thrombus. Typically, when somebody has this kind of thing, I also did an intravascular ultrasound to look for iliac vein compression. This patient did have significant iliac vein compression, but he was from out of town, out of the state, and his follow-up was kind of uncertain, so I opted not to stent the iliac vein compression. Let's go to the next slide. So the next case is a 29-year-old lady, kind of a sad story because she has left upper extremity venous thrombus that's causing significant symptoms, provoked because she has metastatic cancer. Next slide. So here, I took a ultrasound guided access into the basilic vein and put the 10 French sheath in. You could see the venogram here shows significant thrombus in the axillary and subclavian veins. And then, same process repeated over again, getting the catheter past the thrombus, deploying the basket, pulling back. Next slide. And then I just kind of put the end result here. So the device tracks well over the axillary and subclavian veins, and we were able to remove a lot of thrombus. And when I saw her in follow-up, she had no more symptoms on the right side, on the extremity. Next slide. So I found that it's hard to kind of categorize like how if it's an acute thrombus or a chronic thrombus, because they might have presented with a couple weeks. If they present, it could be acute. Sometimes it's usually a mix. And so I found that this one device allows for removal of both. It's a 10 French venous access, which is relatively small. And so I found it's a great option for removing venous thrombus in both the upper and lower extremities.